Tevis, thanks so much. We're going to switch gears. Can you relate? We're talking about anxiety over heading into the Christmas week, COVID-19, families getting together, where we all can kind of relate to that.
Absolutely. And where is Oklahoma in the mix of all of this? We know new COVID cases in the U.S. have nearly doubled since November. Want to talk live now with Dr. Dale Bratzler. He's the OU Health Chief COVID Officer. Doc, thanks for joining us. Where does our state stand right now?
Well, as of Friday, we were seeing about 1,000 new cases a day in Oklahoma. There was no data presented to the CDC on Saturday, so I don't know since Friday, but about 1,000 cases a day. We have just over 700 Oklahomans that are in the hospital, and about a third of those people are in the intensive care unit. So certainly not gone. We're still seeing spread of the virus. And I think most of my colleagues feel like Omicron is probably here. We just haven't identified it yet.
Our state is surrounded by other states with the Omicron variant. What is it about Omicron that's scaring you? Because when we hear about the symptoms, we hear they're milder, more like a cold and not as strong as maybe what we've seen with some of the other variants. So what makes you so worried about the Omicron?
Well, of course, the one thing that we know very well is it's highly contagious. It spreads quite easily. And remember that only about 56% of Oklahomans are fully vaccinated at this point. So there are plenty of people that the virus can spread to. Secondly, we know that even if you're fully vaccinated, you got the first 2 doses of Pfizer and Moderna, and you got them 6 months ago, we know that vaccine protection seems to drop off fairly quickly, about 4 months after those first 2 doses. So strongly recommending getting a booster to protect you. And then I'm not sure we know yet about the severity of illness. A small study from the UK that just came out this past week suggested that it really wasn't that much milder than the Delta variant. So I think we have to watch very, very closely.
It kind of seems like things spread quicker than we can actually get confirmation. So what do you want people to know right now about Omicron and heading into the holidays? We're going to be around a lot of friends and family.
Yeah, so if you're not vaccinated, I think you do put yourself at substantial risk by being around other people. Because once Omicron is here, once it's in our population, it will spread quite quickly. Secondly, we know that you can have breakthrough infections. Even if you've been fully vaccinated, you could be infected with this particular variant and spread it to somebody else. And yes, vaccination protects you from ending up in the hospital. But if you have other family members, particularly older or people who are immunocompromised, you can put them at substantial risk. So remember the things that work for all variants. Wearing your mask indoors certainly works. Outdoor activities, it's going to be very nice this weekend. So outdoor activities are always safer.
And Dr. Bratzler, just for people who always ask back about natural immunity, what do you say to them when it comes to Omicron and some of the other COVID variants?
Yeah, so there's actually very good data now that there are multiple breakthrough infections in people who have previously been infected with a different variant of the COVID virus. So let's say you had Delta or Alpha months ago, you could get reinfected with the Omicron variant. Natural protection probably gives you some protection for some period of time, but it does not prevent reinfection.
Great conversation, Doc. Thanks for talking to us. We always appreciate the conversation.
Yeah, my pleasure.